Welcome to Ethics with Isabella. Psychopharmacology is the branch of psychology concerned with the effects of drugs on the mind and behavior. Today we are going to discuss depression and some of the drugs used to treat it. What does it mean? Part of a doctor's job is to treat patients with pathologies. The most common technique of treatment is the prescription of medications. There are many different categories of drugs that a doctor may prescribe, including pain relievers and antibiotics. Psychologists prescribe things such as antidepressants or anti-anxiety drugs to treat patients with mental disorders or irregularities. Many of these drugs involve serotonin, a human hormone, deficiencies of which are known to be linked with mental disorders. Today I'll be talking about two of these drugs: imipramine, a tricyclic antidepressant and a serotonin inducer, and fluoxetine, also known as Prozac, which is a selective serotonin reuptake inhibitor, which targets and interferes with serotonin transporters. This can be used to treat depression, OCD, and panic disorder. I've read an article called Makeover by Peter Kramer, which can be found on page 205 of our biomedical ethics textbook. This article focuses on a concept called cosmetic pharmacology, a term coined by Kramer which focuses on the difference between treating a pathology into normality and treating into the realm of enhancements, similarly to the cases we talked about in class with ADHD, and how the dangers of treating this way can trigger diagnostic bracket creeps, allowing people in the lower part of the normality range to get ahead of people with the actual pathology. Tess had a very difficult childhood, basically raising her siblings due to an absent father and a depressed mother. She had a disastrous first marriage with an alcoholic, which all took a toll on her mentally. She visited Peter Kramer for help. He states that she showed almost all of the symptoms of depression. Tess, however, did a remarkable job at hiding them. He states, "She was a pleasure to be with, even depressed. He decided that she was in need of medication in order to have a better quality of life. He started her on a low dose of imipramine, which she kept on for about a month. They continued to meet up and check for signs of depression and prevent against a relapse. Tess began to struggle with work and was not able to complete the jobs well before she took the medication." Here's where we see the first possible ethical issue. At this point, Tess did not consider herself depressed. She was going through a rough patch, as most people do. Kramer was not satisfied. He wanted to continue treating her, although she did not demand or particularly need treatment. He said, "My goal was not to transform Tess, but restore her." She was then prescribed a higher dose of imipramine, but began to see side effects, as many patients do with all depression medications. She suffered from dry mouth, daytime tiredness, and weight gain. He prescribed her fluoxetine, also known as Prozac. The drug was new at the time of her case. For her, the drug changed everything. She was able to live a very heightened life. She began to experience things she had never experienced. She saw many positive changes. It all seemed too good to be true. This medication seems to have taken effect immediately, freeing Tess of all of her prescribed issues. He states that this ability to change personality adds to Prozac's popularity. It can take someone with clinical depression months or years to come out of it, or even on medication. They must learn to trust others and the world again. It doesn't normally change overnight like it did for Tess. She was on the medication for 9 months and was feeling great still. After 8 months off her medication, she felt as if she was slipping. She said she didn't feel like herself, which Kramer did pick up on as being a strange concept because she had been depressed for 20 to 30 years and was only acting in this heightened way for about a year and a half. Through all the doubt Kramer expressed and noticed through this whole process, he did re-prescribe her Prozac, which caused her to feel the heightened state again. We can draw some strange parallels between the drugs used to treat mental disorders, such as Prozac, and street drugs, such as amphetamines and cocaine. They are all stimulants. They heighten your mental state and cause you to feel better. Many people say they need them to feel normal. This is a tolerance and a reliance. Once you get the taste of the heightened state, everything is not as good. Kramer says there's quite a danger with Prozac. It is so powerful, it acts like many of these illicit drugs, and could find itself in the business of the American drug trade. We see two ethical issues in this case. The first one, we see Tess complain of issues with work. She's been struggling with work, but not particularly asking for medication or dealing with depression. Here, however, Kramer was not as satisfied. Having a desire to treat, he continued to try and treat a depression which may not have even been what she was suffering from. This issue here is a desire for a quick fix. This is problematic because we look for a quick fix rather than a long-time solution. Another ethical issue arises when we see what Tess experienced as a heightened state with this medication, and we see withdrawals later and a want for more. She seems not to be content with normal life after she has been off this medication, thus developing a reliance on it. Similarly to the issues with Ritalin and ADHD, it is important to have a regular procedure for diagnosis for therapists all over the world, as well as a treatment plan that can help the patients move into the realm of normality rather than into the realm of enhancement, which will cause them to have issues re-entering normality as they come off the drugs. What we would look for as a solution to this case is a standard and thorough diagnosis. Because these drugs are so powerful, we commonly see reliances on them, so we would only want to use them in the most dire of cases. Thanks for watching!